Okay, everyone, full confession here. I have spent way too much time trying to figure out this green screen behind me, trying to be all fancy, and I can't get it figured out. So I am just going to go ahead and record this lecture about anatomical terms, and we're just going to adjust it. You guys are going to figure it out right along with me. So if you're watching this and you are really good at video stuff and using green screens and whatnot, reach out to me and let me know. What I'm going to talk to you about today is going to go right along with the anatomical terms PowerPoint that is in your week 1, module 1 Canvas, okay? This stuff, when we are talking about anatomy, this stuff is so important so that you are able to understand where certain body parts are. If we talk about a bone being anterior or a muscle being superior, those directional terminology, medical terminology is essential in helping you be able to locate and identify where various structures are in the human body. So that's what we're going to talk about. The chapter 1 lecture, we talked about anatomical position. So if you are in a space that you can do this right along with me, I want you to do it right along with me. You guys are hands-on learners. Do it. Stand up, do it. And if you aren't in a space where you can do that and feel comfortable with it, watch it now and then come back to this while you are in a good space, okay? So we talked about anatomical position. Anatomical position is when you are standing with your feet like shoulder width apart. You're standing upright and erect. Your arms are down at your side, and they're what's called in a supinated position. Supinated position means that these forearms are up. So we think about supinated, and I'll talk about this in a second, like holding a cup of soup, that they are up, okay? This is anatomical position. This, not anatomical position. Your palms, your face, your eyes are facing forward. This body stands here. Anatomical position is what we will always go back to and what we will always refer to when we are talking about anatomy. So let me give you an example of this. The ulna and the radius are two bones in the forearm. We have two bones down here in the forearm, the ulna and the radius. When we are talking about them being a person being in anatomical position, the ulna is the most medial bone, meaning it's closer to the middle of the body. We're going to go through those. The radius is the most lateral bone in anatomical position. Now, if I were to ask you a question, which bone is more medial, the ulna or the radius? Your mind should automatically go to thinking about a person in this position, in anatomical position. The answer to that would be that the ulna is more medial than the radius. Now, our forearms at the elbow joint can do something cool called pronation. So again, this is supination with a cup of soup. And if we were to turn our hands in like this, that is called pronation. Now, when our elbows, this happens at the elbow joint, when our elbows go into pronation like this, thanks to the help of our muscles here, this kind of flips around our radius and our ulna and where they're located. So if I had a person, if I were to tell you of a person standing in this position, and I were to say, right now, which one is more medial? The radius, because the bones actually flip over on themselves. Okay? Every time you are thinking about where a body part is located, you go back to anatomical position. Can't really see my feet super well in this, but I'll adjust as we keep going in the video. But they are shoulder width apart, face is facing forward, eyes are facing forward, palms are up and facing forward. This is anatomical position. Now, if we take a person and we talk about them in anatomical position, I'm moving along my slide here, so I make sure I'm with you guys if you're following along in your slides too. If we talk about, or if we still take someone who's in anatomical position, I'm looking at figure 1.7 on the PowerPoint lecture. There's something, again, from an identification standpoint, really, really important called planes of reference. Planes of reference. Your body is divided up in 3 separate sections when we are talking about references. The 3 sections are the sagittal plane, the frontal plane, and the transverse plane. I'm going to say it again. The sagittal plane, find it on your PowerPoint, the transverse plane, and the frontal plane. I said them in different orders both times. Okay, so let's talk about the frontal plane first. If I were to take, let me try to find something that's close to me right here. If I were to take a book and I were to take it and I were to put it right on the top of my head here, and it were to slice through my whole body. So essentially dividing the front part of my body and the back part of my body. That is dividing up the human body into the frontal plane. We have a front and we have a back. So again, if I were to take something and like you can see in this person, imagine like a piece of plexiglass or something like that, sliding right through someone, right through the middle of their head, down their spine, dividing them into a front and a back. That is the frontal plane. Now, this is important because when we talk about various body parts, various muscles or bones, organs, we can talk about them in relation to which plane they are in. The next one I want to talk about is the sagittal plane. So again, person still in anatomical position, make sure you're in that position with me. Sagittal plane is if we would split the body in half this way into a left side and a right side. So if I were to take this book and keep slicing my body down, that would be dividing us up into the sagittal plane, okay? Still in anatomical position. So frontal plane, dividing the body into a front and to a back. Sagittal plane is dividing the body into a right and into a left. Then we have the third plane is called the transverse plane. The transverse plane kind of cuts the body in half here. These are really important when we're talking about various types of motions. So in the sagittal plane, let's talk about that. The sagittal plane, if I am walking towards the camera, my body is moving in the sagittal plane. If I am sidestepping, my body is moving in the frontal plane. If I am doing ab twists or bending over to, grab something and reach something, that is happening in the transverse plane. This is important, right? Because of how our body moves and the muscles, the bones, the ligaments, everything's going to hold things together to allow us to get through a certain motion. These are also important. I'm flipping my slide now here to slide 4 of this lecture. These are also important when we're talking about various pictures and various images of the human body. Again, for those of you who are interested in radiography, these planes are going to be so crucial for you and what you're going to be seeing on a daily basis. So again, sagittal, the frontal, and the transverse plane. Let me make sure I covered all I wanted here. I did. Okay, good. Now, the next parts we're going to talk about are directional terms. The directional terms are frequently, you guys, I'm going to be saying them all the time. These are terms that are used to give reference points for where various body systems are or various structures are. These are really, really, really important for you to know. So do them along with me. I'm skipping down to slide 6 here, and I'm going to go right down this list here. I'm going to pull myself back up so I can see myself and be conceited. So here is, we're going to talk through these directional terms starting at the top here. Anterior. Anterior means towards the front of the body. Towards the front of the body. Posterior means towards the back of the body. So if I turn this way and I'm facing this way, anterior is going to be towards the front of the body. Posterior is going to be towards the back of the body. So the example that's given here is that your sternum or your chest bone, we know, I think you know, that protects the heart. The sternum, that bone right here, is anterior to the heart. It's in front of the heart. Again, considering anatomical position always. The sternum is anterior to the heart. Now again, posterior is going to be meaning behind. I don't really like this example they give about the esophagus and the trachea because I don't think that's super common knowledge. But we could think about your booty, right? Like you talk about your posterior that your gluteus maximus, or your butt muscle, is posterior to your abdominal muscles. Your abdominal muscles are anterior to your gluteus maximus, or that posterior musculature. Anterior is going to be meaning towards the front of the body. Posterior is going to be meaning towards the back of the body. We can also use the terms ventral and dorsal. We're not commonly going to do that in this class, but from a reference point for anatomy, it's important for you to know these things. Ventral is meaning towards the anterior side, and dorsal is meaning towards the posterior side. They are kind of used interchangeably, but they mean a little bit of different things. Let me think of that example there. Yeah. So we could use those interchangeably. Anterior or ventral to the front, posterior or dorsal to the back. Dorsal meaning like a dorsal fin on a shark or a fish or something like that. I think that's only like on sharks. I have no idea. But a dorsal fin is that fin that's at the top of a swimming animal. Okay, so we have covered anterior, posterior, ventral, and dorsal. Let's now talk about superior and inferior. Now, you notice how I'm talking about these, you guys. Anterior, posterior, I should say it this way. Anterior, posterior, opposites. Ventral, dorsal, opposites. Superior and inferior. Superior is going to be meaning above. Inferior is going to be meaning below. I think those ones make a little bit of sense. Those are common things that we use in language about superior. Maybe, I don't know if you use them commonly. Anyways, inferior, below. Now, let's use this example. I don't like the examples they give here, so let's break it down a little bit easier first. My heart is superior to my legs. Okay, it is above my legs in anatomical position. My toes are inferior to my knees. They are below my knees. My toes are inferior to my knees. So the examples that is given here from the book is that the heart is superior to the diaphragm. Your diaphragm is about right here. Your heart is superior to the diaphragm. You could also then say it in the reverse, right? The diaphragm is inferior to the heart. The other one they give, the inferior, is the liver is below the diaphragm. The liver is below the diaphragm. So if I were to ask you, is your shoulder superior or inferior to your head? What would you say? Is your shoulder superior or inferior to your head? Inferior. Good. Now, if I asked, is your, let's think about this, is your elbow superior or inferior to your shoulder? Is your elbow superior or inferior to your shoulder? Inferior. When we keep learning different anatomical structures, I'm not going to say things like your shoulder and your elbow. I'm going to say your glenohumeral joint and your elbow joint, or the head of your humerus and the capitulum, right? See where I'm getting at? So when I'm saying things like right now, this is where directional terminology is important to learn and to go back to. I don't care if you got to do flashcards, you got to tape it up on your wall, or what you got to do. But right now it's basic for us to say like head and heart and hips and toes. But when I start saying things like I should have prepared this better, is your patella superior or inferior to your femur? That's where understanding these directional terminologies is really, really, really important. Okay, so we did superior, inferior. Okay, so we're going to skip over, let me look at these here. Yeah, we're going to skip over cephalic, rostral, and caudal, and I'm going to talk about medial. Okay, we don't use those. It's important to know cephalic, rostral, and caudal, but we're not going to use those in common terminology for this class. The next one is important, is medial, toward the midline of the body. Okay, so anatomical position here. The middle of my body, if we remember when I divided myself up in this plane, right? Which plane is this? Sagittal plane. Good. If I were to take this book and I were to slice it right through my head like this, that would be in the sagittal plane. This is going to be the middle of my body. So that makes sense. If we were to take a line and we were to draw a line right through your body, that is the midline. This is really, really important when we are talking about anatomical structures, because we need to identify body parts according to how close they are to the midline. So if you look at my fingers right now, if you can see my fingers well, which one of my fingers, use layman's terminology, which one of my fingers is closest to the middle of my body? My pinky finger, right? So when we're standing in anatomical position, what I would say is that my pinky finger, or my fifth digit, is the most medial out of all of my digits, out of all of my fingers. Now, I'm going to go back. I'm going to see how close I can get here. I talked before about the ulna and the radius, our two bones right here. And I use that term medial. Medial is the ulna. It's closest to me. So if I were to like highlight that, right? Like if you're doing notes on this, the important thing to consider with medial is the me part, M-E. That is closer to me. So when we start identifying muscles, when we start identifying more bones, and I were to ask you, or I were to say, this bone is more medial than this bone, what should automatically connect with you is that medial. Medial means closer to me, closer to the midline. Now, in this example they give in the slide, so I'm on slide 6, is that the heart is medial to the lungs. Now, that makes sense, okay? So the lungs, we know we have two lungs. Most individuals have two lungs. And on the inside of where the lungs fit is the heart. The heart is more medial, or towards the middle, than the lungs are. You guys with me? Okay, that's medial. The opposite, I'm going to go to slide 7, which I wish these were on the same slides, but they're not. The opposite of medial is lateral. Lateral. Lateral means away from the midline of the body. Away from the midline of the body. So again, anatomical position. Let's talk about these two bones here. In fact, pause for 1 second. I know, here I go. Okay. Don't you guys wish you had me in class, really? Okay, so if I'm gonna keep talking about these bones here, so I'm gonna draw them. This bone here is the ulna, and this bone here is the radius, okay? Now, we talked about these two, and I talked about the ulna being more medial than the radius. Now, if we're doing this opposite effect, right, like we have already been doing, then that means that the radius is more lateral than the ulna. I said that right. The radius is more lateral than the ulna. So that's how we are using those opposite directional terms of medial and lateral. The example that's given here is the eyes and the nose. So your nose is going to be more medial. Your nose is more medial than your eyes. Your eyes are lateral, or towards the outside, away from the middle part of your body, than your nose. Okay, so again, medial, lateral. Medial closer to me, lateral further away. Now, let's talk about proximal and distal. Proximal and distal. So proximal, like proximity, distal, a distance. Those make sense, I think, right? Think about what that might mean. So proximal means closer to the point of attachment or origin. And distal means further away from the attachment point. This gets kind of tricky, and these are going to be so important when we are talking especially about your muscles, okay? Proximal and distal. So we have muscles that attach to various body parts. So let's talk about your bicep. I'm just going to keep drawing on myself because why not? This is a recording, right? So this is actually what your bicep muscle looks like. You have several muscles here that actually make up this big bulk muscle of your bicep. But your bicep, bi means two, has two heads right here. The bicep actually comes up and its proximal attachment is all the way up here. Its distal attachment is all the way down here, crosses over the elbow joint. So when we are talking about the location of where muscles attach, we're going to talk about proximal, meaning closer to the attachment point, and distal, meaning further away from the attachment point. Kind of like inferior and superior, right? But we're talking about attachment points, origins. That's the kicker here. That's the difference between superior and inferior. Ipsilateral and contralateral. Ipsilateral and contralateral. Ipsilateral means on the same side of the body. Contralateral means on the opposite side of the body. So the examples that are used here are our internal organs. So the liver is ipsilateral to the appendix on the same side of the body. The contralateral means on the opposite side of the body. So the spleen is on the opposite side of the body to the liver. I'm trying to think of how else I can term those. Those are probably, that's probably a good way to do it. Ipsilateral, same side, contra meaning like opposing on the opposite side. And then these, again, superficial and deep are going to be really, really important when we talk about musculature. If you think about someone, again, being in anatomical position, the anatomical position is valuable when we're talking about, or I'm sorry, superficial and deep is valuable, going back to anatomical position. In your forearm here, I'm going to keep going back to the forearm. There's a ton of muscles, right? When we get to this point, you guys are going to be like amazed at how many muscles there are in the forearm here. Some of the muscles are deep in there, and some of them are superficial, meaning they're closer to the skin. So like I can see some, if I were to, you do this with me, okay? Don't make me seem like the only crazy one here. Make a fist and kind of move your arm around so that you can watch the muscles move a little bit. You can, the muscles that are going to be closest to the skin, that's called superficial. When they're deep in there. You can't see them really from the top. In cadaver dissection, you have to pull away those top layers, the superficial layers of muscles, in order to see those deeper ones. So superficial means closer to the surface, superficial, super like above. And deep, I think that one makes sense, right? Means farther from the body's surface. And the body's surface is what we're going to be considering like our skin. We can also talk about that in relation to like an organ and an organ structure. Towards the outside of the organ, the shell around the organ, if you may, is superficial. And then as we get deeper into the organ, there's a more complex system. Superficial, deep, superficial, deep. Okay, so there's the opposite ones there. And that's the end of those directional terms for now. We are going to get back, I'm like looking at my arm, we are going to get back into more directional terms when we're talking about movement. Movement is a really important thing to talk about, how our body is moving and what these are called. Because as we get talking about muscles in particular, it's going to be important for you to be able to identify, like I think it's common knowledge, right? That here's your bicep muscle, as I drew on myself. Here's your bicep muscle. And the bicep muscle is going to help you do this. This is called flexion. So when you're affiliating the bicep muscle with the action that it does, we're going to go through a whole bunch of other motions, but this is where we're going to stop for this point and these directional terminologies. So thanks for dealing with my crazy, and I hope you walk through it with me. If not, go back to it, do it again and again and again, and think about anterior, inferior. I'm sorry, anterior, posterior, inferior, superior, contralateral, ipsilateral, medial, lateral, superficial, deep. Think about it. And try to, think about it like in your everyday life while you are moving through things and you're doing things. My head is superior to my knees, right? My knees are inferior to my hips. Think about it. You can apply these, and then that action of applying them to your life will help you remember it more. All right, I'm going to stop talking because I could go on forever about this.